Mr. Luke.
Thank you very much indeed, Madam Deputy Speaker. And I must say that I do wish that this House had been completing the really important and necessary Brexit legislation today. But having said that, it is always a particular pleasure and indeed a responsibility to speak on the important subject of the NHS. And I too would like to start by thanking every member of the NHS for what they do. That actually includes 2 members of my own family. The pressures on them are unrelenting day in, day out, and all of us need to acknowledge that in this House. And I too have personal reason to be hugely grateful to the NHS. At the age of 24, it saved my life with an emergency operation in the hospital just over the river in the middle of the night. I had a hemopneumothorax, and I would not be here today making this speech if it wasn't for the brilliant care that I got some 30 years ago. Now, carrying on looking at the staff within the NHS, having met with a number of the presidents of Royal Colleges last month, they said to me that they think we actually need to double the number of medical students that we are training. Brilliant news. We recently increased that by a quarter. The level of demand is such that we, with the people review going on in the NHS, are going to look to need to double that. It is also something I think we need to look at, that I understand the evidence is that up to 1 to 3 hours of every day of the work of a doctor could be done by non-clinical healthcare staff, and we need to think about that, so we are using our staff as effectively and appropriately as possible. It does hugely concern me how many medical students we lose from this country who we train at public expense, who then go off to Australia or to Dubai or somewhere else. Are there some perverse incentives in the system? And actually, where is the value for money for the taxpayer after we have trained them? I also hear from staff that sometimes they are working with computers that take half an hour to warm up. And yes, we want to get rid of the fax machines, yes, we want the latest technology, but computers that just turn on and work are really, really important for NHS staff under pressure. We need to look at putting more nurses into care homes to stop inappropriate visits from their care home residents to accident and emergency services. We need to make sure there are enough practice nurse courses in rural areas. There are gaps there that is leading to poaching. We could perhaps use the apprenticeship route. I understand that of medical school students who graduate, 27% of those are going into general practice, but I understand from the Royal College of GPs that needs to be nearer 50% in order to meet the acute need for doctors in GP practices up and down the country. And there is also very great variability in the proportion of medical students that go into general practice from our medical schools, and we need to learn to raise the proportion going into general practice because that need is so acute. I'm also concerned that we don't have a proper career path for associate specialists, particularly in surgery, in our hospitals. These are very valuable members of staff, but they can drift around the system a bit, and I understand about 20% of them are leaving, so we need to look after them better and plan for them more appropriately. We need to link our health visitors more closely with the new primary care networks. Health visitors do invaluable work, in particular their national child measurement data doesn't get transferred to GPs in the way that it should do, and that leads to problems not getting on top of childhood obesity. And on the issue of childhood obesity, as a co-chair of the all-party parliamentary group on obesity, it's great we've got Chapter 3 of the Childhood Obesity Plan, but I would just remind the Minister the actions from Chapter 2 that we've not yet implemented, the watershed, promotions and point of sale, we do need to see implementation on them. We also have a very bizarre issue, in that the Quality and Outcomes Framework doesn't cover children's weight. In fact, it specifically excludes it. It only covers adults. Come on, we need to vary the contract to make sure that that does measure children's weights. And we must do better on fetal alcohol syndrome disorder. I think we need that in PSHE. We need a massive public campaign on that. I'm awaiting a letter back from the Secretary of State on that. It is a huge and growing issue that we don't talk enough about in this House. Madam Deputy Speaker, we live in an obesogenic, polluted environment with unacceptably low levels of active travel. We need to design the healthy environments of the future if we are going to relieve the NHS of pressures which are otherwise going to overwhelm it. We also need to be aware of the opportunities that NHS staff have to spot incidents of modern slavery. And I would like to commend a very alert healthcare worker last week on the eve of Modern Slavery Day who spotted the first victim of modern slavery in her hospital because she was alert to the symptoms and she'd done the training. NHS staff have a unique opportunity to bear down on modern slavery, and that's so important. And I was staggered to hear from the SNP spokesman that the taxpayer is paying £80 billion out for £30 billion worth of hospitals. I think that was the figures that she told us. For £13 billion, so it's even worse than she said, and some trusts paying up to 16% of their income on PFI payments. You know, we really must learn and do much better than that.